Hello, my name is Jacob Fusen. I am a student of University of New England. This presentation is for pathophysiology over a disease of my choosing. This is a note card with my name and a list of topics I will be covering. The disease I have chosen is type 2 diabetes mellitus, also known as adult onset diabetes, although this verbiage is decreasing as time goes on because the prevalence of obesity is increasing in adolescents and children. This is resulting in more cases of type 2 diabetes in the populations of adolescents and children, making it no longer an exclusive adult disease. The definition is a disorder causing abnormalities in insulin and glucose metabolism. It is classified as a complex metabolic disorder. In normal physiology, the beta pancreas cells secrete insulin into the blood. This insulin helps glucose enter cells, which the cells then use for glucose metabolism, creating energy. They use this energy for the necessary bodily functions. This also has a side effect of decreasing glucose levels in the blood, preventing hyperglycemia and its complications. In type 2 diabetes etiology, beta pancreas cells still secrete insulin into the blood. However, insulin resistance has developed, decreasing insulin sensitivity for receptor cells, meaning that more insulin is required to get the same amount of glucose into the cells, decreasing metabolism and resulting in hyperglycemia. It is unknown what causes it, what is the main cause of it. However, risk factors include genetics, environmental and lifestyle choices such as obesity, low physical activity, and diet choices. A poor diet can lead to hyperglycemia and related disorders. This syndrome it falls under is a metabolic dysfunction syndrome. Clinical manifestations include increased urination due to the renal threshold of glucose being breached. Glucose is secreted or excreted through urination, and water follows it due to the water gradient following it. This also results in dehydration due to excess water release, resulting in decreased fluid retention. The glycosuria will also result, or sweet-smelling urine. Glucose is in the urine, and glucose smells sweet. Therefore, you have sweet-smelling urine. Fun fact is this term was actually coined by the Greeks, who used to smell and sometimes taste urine to determine disease types. Other clinical manifestations include decreased wound healing capacities due to decreased metabolism, increased hunger due to cells not getting enough glucose, so even though they're surrounded by food, they cannot metabolize it. Also fatigue and eye problems potentially due to fluid movement because of the pressure or the gradient changes of glucose in the eye. Some diagnostic tests that can be run to determine this. There's two very common ones. The first one is the plasma fasting glucose test. You fast for 8 hours, and then you measure a blood test is taken, a blood sample is taken, and then you measure the milligrams per deciliter of glucose in the blood. A value of 100 to 125 is considered to be pre-diabetic, or you have prediabetes. Over 125 milligrams per deciliter of blood is considered to be diabetic, or you have diabetes. The other test that is relatively new, but is preferred by many because you do not have to fast, is the A1C blood test. This is a measurement over the last 3 months of glycated hemoglobin. It is measured in a percentage, and 5.7% to 6.5% glycated hemoglobin blood is determined to be pre-diabetic, or you have prediabetes. Over 6.5% is you have diabetes, or you are diabetic. A differential diagnosis example would be a patient comes into the doctor's office complaining of fatigue and weight loss. Also, when they eat certain foods such as bread, They found most commonly it's starches and carbs, potentially, is they feel nauseous and they have abdominal pain. The doctor may want to test for celiac disease and type 2 diabetes. Using the A1C test or the fasting plasma glucose, they could rule out or confirm type 2 diabetes. Some complications that can occur with this disease are hyperglycemia leading to nerve damage, which would result in tingling or numbness, especially in the extremities. The lower extremities are more common. It could also lead to kidney damage or renal failure due to excess glucose damaging them. It can also result in eye damage, such as glaucoma and other diseases similar to that forming. It would decrease wound healing time and it result in general fatigue and potentially weight loss. This concludes my presentation on type 2 diabetes. Thank you for listening.